Hello guys, so I finally wanted to make this video to chat a little bit about the difference between medical grade, pharmaceutical grade, and drugstore or cosmetic skincare. I get asked this question almost all the time, which is what's the difference between pharmaceutical and drugstore, and why should I purchase pharmaceutical compared to drugstore? The answer is very simple and straight to the point. Number one thing that I always tell my clients is that drugstore or cosmetic skincare, they can essentially claim whatever they want on their product, and they do not need to have any clinical research or any type of studies or research to back them up. Medical grade skincare must have research and clinical studies to back up what they're stating that their products do. Cosmeceutical grade, again, whenever I say cosmeceutical grade or drugstore, I'm talking about, skincare that you would find, let's say in Walmart or Walgreens or even La Roche-Posay or Clinique. Those are all cosmeceuticals, and those are all essentially quote-unquote drugstore. Pharmaceutical grade would be something like Glymed, something like Circadia, something like Obagi, and so on and so forth. Now, for the cosmeceutical grade, you have to keep in mind anybody can access these. Anybody can access these, so they have to make them safe for the public. And by making them safe for the public, it means they are legally not allowed to put enough active ingredients into the products for the product to actually work and give you the results that you need and you are looking for. Cosmeceutical grade skincare is only requested by the FDA to have 70% of pure ingredients, and the rest is essentially synthetic ingredients such as fillers. So their capacity to bring you results is a lot lower compared to medical grade. Now, on the other hand, pharmaceutical grade and medical grade products, moving forward, I'm just going to call them medical grade. And medical grade, for instance, the one that I'm specifically talking about is Glymed. The medical grade ones, they are requested and regulated by the FDA to have 99% pure ingredients. So 70%, 99, 70%, 99, that's a really big difference, guys, when it comes to skincare. Medical grade skincare such as Glymed, they are filled with active ingredients. What are active ingredients? Active ingredients are essentially any type of ingredient that is going to activate underneath your skin and really kind of almost like communicate with your cells, therefore work more efficiently. So again, their active ingredients is a lot higher, and their percentage as well is a lot higher compared to the drugstore ones. Also, the level of penetration is a lot more potent compared to the drugstore ones, so which means that the medical grade penetrates a lot deeper into your skin, therefore giving you better and quicker results. Skin has 3 layers, okay? So think 3 layers of cake. First layer is the epidermis, second layer is the dermis, third layer is just fat, essentially. Cosmeceutical grade can only reach the epidermis, compared to medical grade can reach the dermis, which is the deeper level of the skin. So if the pharmaceutical grade products reach the dermis, you have a lot more chances to actually improve your skin and improve any type of issues you have. That is my son peeing. I apologize. So why is it important for the products to have to reach your dermis? Because in your dermis, that is really where all the important things are, such as collagen, elastin, fibroblast cells. So essentially everything that is keeping our skin tight and youthful is coming from the dermis. So that's why there is really no point in purchasing drugstore that only stays on the top layer of your skin. Therefore, you might feel like your skin looks good in that very moment, but it's really not helping you in the long run. Now, does that mean that over-the-counter products don't work at all? No, guys, that's not what I'm saying. I'm not saying that over-the-counter products do not work at all. I am sure you guys have all eventually at some point in your life found an over-the-counter product that you really liked.
This is how you can do it. Okay, so
My train of thought, I was saying, I'm sure at some point in your life you have found an over-the-counter product that you liked, you really felt worked well for your skin. Then eventually, whether it's 4 months, 6 months, 12 months, you just feel like this product is no longer giving you any positive effects on your skin. And ultimately, you end up spending a lot more money on these drugstore products because you have to use a lot of product and they do not last you a long time. Compared to pharmaceutical grade, a little bit goes a very long way. You will see if you are somebody that uses Glymed or you are already somebody that uses pharmaceutical grade. You can see that a little bit goes a long way. You have to put very little and it works for your whole face. I just want to give you an example of what I mean by that, so 1 second. Okay, so this is my amino acid epidermal sealant with PC10, which are peptides. Okay, this is my favorite moisturizer of all times. Now, I don't usually recommend this for my clients just because it's a pretty pricey moisturizer. And there are other options that are very, very good, but I like to have the best for my clients during treatments. So this is why I went ahead and purchased this. Now I do want to show you, okay? Look how much I am using. Bible, this is all I am using. Okay, look. Now, no BS here, guys. You can see that I have a really good amount of slip here as well. I have a good amount of slip. So that little bit literally just moisturized my whole face. Okay? Totally moisturized, and you saw that I used very, very little. So classic example of why pharmaceutical is just the best. Okay guys, I hope I answered all your questions in regards to the difference between pharmaceutical grade products and cosmeceutical grade products. If you have any questions, please leave comments below and see you in my next video.